My name is Adekunbi Bello, and I would like to welcome everyone to today's discussion on telehealth adoption across Africa. And today I would like to be having a specific focus on Nigeria, and we'll be sharing insights on the current state and challenges, the opportunities for telehealth integration in our healthcare systems. I would like to share a story before I go ahead. In my first job in healthcare, I was fresh out of school. I was very green-eyed, and I was working in an hospital where we had different specialties. It was a specialist hospital, and one of my first interactions with anything that had to do with either digital health or telehealth. Sorry. Okay. Either digital health or telehealth was with electronic medical records. I'm sure a lot of our health professionals are very conversant with that. The hospital was trying to integrate that's the electronic medical records with their current offerings, right? And it was a struggle because there were a lot of challenges. Because first and foremost, doctors were used to pen and paper, files. I don't know if you I'm talking about 10 years ago in Nigeria, where when you come to the hospital, they will call your name, then they will go and look for your files, like and sometimes you spend 1 hour in them trying to trace your files, and there will be some missing diagnoses or something because everything was paper led, right? And when the hospital was trying to transition into using electronic medical records, it was quite a challenge because a lot of doctors were used to writing, a lot of the nurses, a lot of the other admin staff, they were used to like carrying physical documents. So how do you expect people that have been doing this for over 30 years to now like transfer the records to a computer and can access it? So it was a struggle, and I was part of the team that was tasked with the I wouldn't say with the burden, but with the responsibility to integrate that new initiative. And it was very challenging, I wouldn't lie, but we're able to, right? And I wouldn't say we were there, like when I exited that organization, I would say that there was at least 40% adoption, which is very which is very strange because normally if you had been somewhere else, they probably would not even be able to achieve that change that they were trying to do, because people are literally, even patients will say, oh, I'd like to see my file. And it's just what people are used to. So bringing something new, something that's different, something that people are not used to, there would always be some form of resistance. So I just wanted to create that basis that, oh, this is not something that people are used to. So definitely telehealth is not something that a lot of people will be first receptive to. You have to do a lot of explaining and showing them that this actually works, right? So moving on, our discussion will move from the current landscape, that's what is currently obtainable, right? And then examining what's working, right? Through documented benefits, identifying key challenges, and exploring practical solutions, right? So I'm just going to move on to the next slide. Yeah. All right. So our discussion will move from the current telehealth landscape in Africa, the benefits and success stories, the implementation, and then the practical solutions, and then future outlook. All right. So I did some research, right, when I was tasked to come speak at this webinar, because I understand that maybe what was obtainable, I've been out of Nigeria for a while now, so what was obtainable then, maybe there's been some improvement. And based on some papers that I read, I was able to bring out some of this, and then from my experience as well, I was able to bring out the current, that is in quotes, telehealth in Africa, the current state, right? So the first one is, it is still developing in many sub-Saharan African countries, according to Mbunge et al. That's as of 2022, and this was after the pandemic. And one thing I'll tell you is that telehealth accelerated during the COVID-19 pandemic. I'll also share a story, because one thing I like to do is that I like to bring these things home so we can relate to it. After exiting the hospital, I worked with a mental health organization. And when we were trying to come into the Nigerian market, mental health was zero. Or let me say, maybe people knew about mental health, but it was something that people would say, oh, God forbid. It's not, they didn't know what mental health is. They just know what mental illness was. And I remember when I would go to organizations because it was a corporate, we're trying to sell it as a corporate program, which is the employee assistance program. And then I would go to organizations, I don't want to mention their names, and we were talking about what we could do, right? Because the innovation was something that we had seen work in other countries like the UK, the US, and we're trying to bring it home for us as Nigerians. And then a lot of people would be like, okay, they really don't understand this thing, but they're open to it. And so people will be like, no, we're not open to it. But then COVID happened, and we know that COVID shook everybody, right? There was a lot of uncertainty, there was a lot of chaos, and a lot of our health professionals, right? They were literally struggling because the hospitals were overflooded, everybody was ill, and there was just a lot of chaos and uncertainty, and everybody wanted care, and they wanted care now. And what we had been preaching before COVID, which was virtual care, trying to assess mental health professionals or general practitioners via like calls, video, teleconferencing, and all of that. We had to, it became more, what would I call it? People were more receptive to it because otherwise you can't go into the hospital. So you see what COVID did, because for during COVID, you could not walk into the hospital except maybe you had an appointment or you're going to go through a lot of rigorous checks before you could see a doctor. But when COVID happened and then people saw that this is not something that they can actually walk into the hospital to talk about, they were more receptive towards telehealth. So I would say that COVID-19 pandemic was a blessing in disguise because this was something we're still trying to get people to adopt. And then something happens and then they realize that this is the only choice we have. So we have to make do. And then looking at the current adoption across countries, right? South Africa remains leading in specialist consultations, in specialist teleconsultations in Africa. And then this is followed by Kenya, right? Which is the strong maternal health integration. That's the mHealth integration that they have. And then we have Nigeria, right? We are advancing, actually. We are actually advancing, right? Despite very serious infrastructure challenges. And then one thing I want us to also remember is that according to recent systematic reviews, the adoption was accelerated because of the COVID-19 pandemic. And then we can see different patterns emerging from these countries, from South Africa to Kenya and then to Nigeria. And then moving on. Please, did my slide just move? It's not moving.
No, it's not moving yet.
Okay.
It's still on the okay, yes, it has moved now.
Okay, all right. So we're talking about telehealth. We're talking about, let's try to implement telehealth. Let's try to adopt telehealth. Let's be more receptive towards telehealth. But what are the benefits, right? I want us to start from the benefits. Why should we consider telehealth, right? Because multiple studies have documented clear benefits where telehealth has been successfully implemented, right? Let's not deny that, especially in the West, that's the UK, the US, and the likes. And then these include more efficient use of limited healthcare resources, right? For healthcare resources that are limited, when you are able to have like the option of virtual care, right, it helps to efficiently manage these limited resources. And then one thing that telehealth also helps is with improved triage systems, right? So I'm going to give another example from when I was working in the mental health space. When a client calls and they need like immediate like mental health assistance or something, sometimes you can actually deal with that situation, right, on the call, which is a form of teletherapy, right? But what people were used to was that if you need to see a doctor or a psychologist or a psychiatrist, you have to go physically to see them, right? But one thing that telehealth helps us to achieve is that triaging is easier. So they speak with, let's say, for example, a mental health first aid expert on the phone. This person understands the severity of the situation. Is this something that needs to be like treated physically? That's maybe will require admission, or somebody that's having CBT, that's cognitive behavioral therapy, on like virtually can work for. So it is very important that people understand that telehealth or teletherapy or teleconsultations can help them, and then also increase the speed at which they are being attended to. Because if you go physically to the hospitals, it might take you hours or days to even see a specialist, but it's something that is available at the click of your phone. So it is very important to understand the benefits, right, of telehealth. And then another thing is protection of medical personnel. During COVID, nobody wanted to see anybody because you don't know what they have, right? So what telehealth did for us was what it made us bring health closer to the people that needs it the most. So some people that maybe their conditions are very crucial, those are the ones that go into the hospital. But those that can still be managed at home, telehealth helped us to bridge that gap, right? And also protect our medical professionals, the frontline people, from from illnesses that could have been otherwise fatal. Right. And then another thing that I personally advocate is that patient experience has to be top notch, right? For them not to see the gap between having physical consultations and then being treated online or treated virtually, right? And then another thing is enhancing social support for patients. Like Dr. Kenneth rightly said, I'm an ex-co-founder of Cito Health, and Tito was my co-founder as well, right? And it was quite challenging, right, to encourage people to use the digital health platforms when we're building in Nigeria, because people were they were just so super hell-bent, right, on seeing their doctor or the medical professional that is attending to them physically. And then one innovation that we added to our offering was that there was like a community built that even how do I explain this? So we had a community online on our platform, meaning people of different people that have similar issues. They had like a community forum where they could share their struggles, and then it was being moderated by healthcare professionals. You can see that some people, they don't even need to speak to a doctor anymore, because from that community, right, which offers them social support, and then they also see people that are also going through the same things, right, and then what they are doing to like manage themselves or get better. It was quite successful. So these are the benefits of telehealth, right? And then I would like to go forward and share some success stories. I'm still struggling with this. All right, please hold on. Yeah, what's working, right? In South Africa, right, there's an increased prevalence of chronic diseases, and it has been managed well via telehealth. It has been managed well via telehealth. For example, Cito Health was a platform that was created to help manage chronic diseases like diabetes, hypertension. And even though we're not in South Africa, we're in Nigeria, but we had significant impact, right, on the people managing chronic illnesses, especially like the elderly people. But the struggle was that they wanted to talk and see the person that they be managed, that was managing them, or the dietitian or the doctor that was managing them. So it was quite a struggle. But in South Africa, there's been like an increased adoption, and it has helped them to effectively manage chronic illness. And I mentioned something about Kenya's Health as well. And then for Nigeria, right, one thing that has been quite successful, right, is remote diagnostic innovations. We have people like Health Tracker, right, Ifeoluwa Johnson, which is a very, very inspiring innovator in the healthcare space. People, before now, if you wanted to do any diagnostic test, you have to go in directly to these diagnostic centers. But our innovation, the Health Tracker, literally brought diagnostic center to people's homes. So they come to your house. I actually personally have used it, so I'm giving a testimonial. They'll come to people's homes, take their samples, test it, and then send them their results with recommendations from a doctor. Like how better can it get? Right. This is something that is working in Nigeria. We also have Beacon Health, and then some other newly formed healthcare innovations, which is something that is really working in Nigeria. Although we are still struggling with the actual like consultations via telehealth in Nigeria, but literally the remote diagnostic innovations is quite fantastic, right? And I'm proud that I was part of that story. And then in Rwanda, we have the National Telehealth Framework, right? And we have people innovating in Rwanda, like the Babel Health. I don't know if anybody is very conversant with that. They are also making sure that healthcare is accessible across borders, regardless of your location in the country. You have access to efficient and prompt healthcare, right, in Rwanda. So now let's talk about the challenges. We've talked about the benefits, we've talked about the success stories, but what are the challenges? What are the day-to-day things that is actually injuring the success of this innovation? I'll start with the logistical challenges, because research has consistently identified that infrastructure is a primary barrier, right? So infrastructure and technology is a primary barrier, like, because beyond like the issues with connectivity in rural areas, there are some inadequate issues such as funding for sustainable programs, inconsistent power supply affecting reliability, and limited availability of appropriate devices for both providers and patients. We're talking about adoption. Oh, there should be telehealth. People should be able to access their doctors from the palm of their phone. But let's look at it. What is the current state in Nigeria or in Africa as a whole? Is it everybody that has a phone that can maybe download an app, or even like WhatsApp? I know WhatsApp, everybody has WhatsApp, but trust me, you've not gone into some interior places where people do not even have, the phones they have are like this normal touch-like phone. Also, there's an infrastructural barrier, right? And then also limited internet connectivity. When I was in Nigeria, I had four, what do you call those things? Those mobile network things, modems, because sometimes I'm on a call, I'm having a presentation, and my network is glitching, and then I have to switch from Airtel to MTN to Etisalat to everything at the same time. So imagine if you are sharing with your doctor a particularly daunting life experience, maybe you're managing diabetes and your sugar level spike, and then you're in the middle of sharing your symptoms to your doctor, and then network glitches. That moment is lost. I don't know if anybody gets me, right? That moment is lost, and you have to now rejoin. You look at the situation I had this morning, struggling with my slides. And this, imagine if it was a network issue, like, and I've been going on and off, the conversation will not go smoothly. So these are the issues. As little as they seem, there are issues that are actually injuring the adoption of telehealth in Africa. Because people will be like, rather than me trying to call my doctor or connect with my doctor online and it's glitching, why not just travel 5 hours to the Federal Medical Center in Uyo to see my doctor? I don't know if we understand it. And then another thing is inadequate funding. We want these our doctors or our nurses or our medical professionals to be able to provide care from their offices to people in the comfort of their home. But do they have the devices, or do we expect them to use their personal devices for work? So these are the crucial areas that we need to start considering. And then the consistent power supply. This is something that it is very, very common in Africa. Even if you've provided them with the devices, they have the internet connectivity, right? How about power supply? We still have people that complain that the reason why they were not online to join a meeting or to join a call is because they didn't have power. And it's a serious issue in Africa. And that's why you'll see more increased adoption in places like in the West, like the UK, US, and the likes, because they have consistent power supply. And nobody will give you the excuse that, oh, I didn't charge my device, that's why I was not able to attend an appointment or a consultation. So these are, as little as these barriers seem, they go a long way when they compound. So these are the things that we need to start looking at, because they vary in severity, but they are present across all the African countries that I have decided to study for this webinar. Moving on. Okay, so we're going to talk about regulatory challenges, right? That's policies. First and foremost, is there any policy that regulates virtual care? I don't know, we have doctors and nurses and professionals on the call. I would like someone to share with me. Do you know of any policy that regulates the use of virtual care, or how virtual care is done to ensure that it's not it's ethical, it doesn't go like it's something that should be done in a very discreet format? I don't know if there's any law like that. I've done my research, but I didn't see anything like that. So the regulatory environment, right, presents a significant challenge. Because a lot of people, like for example, I'll speak for my mom. She would tell me that she will not talk to a doctor online because she's not sure who is listening at the other end. I don't know if you understand. And many countries in Africa will lack comprehensive telehealth policies, creating uncertainty for both the providers and the investors, right? And like I said, I have built telehealth in Africa, and these are some of the issues that we went through. So I'm not just talking from outside. I've been there. I've done that. And these are the issues. And this is why we're not able to get the kind of investment that we require, because we're not able to show that, okay, are the data safe? Are people like, I don't know if we understand what we're saying, because in other parts of the world, there are regulatory policies that regulate the virtual care environment. For example, in NHS, because I'm currently in the United Kingdom, and they have regulatory policies that regulates virtual care, telehealth, and all the likes. But we don't have that in Africa. And then the political will as well is often missing because regulatory frameworks remain underdeveloped and sustainable funding models are rarely established, right? Because this is something I went through as a founder in Nigeria. It was because we don't have that regulation. A lot of foreign investors will be like, we are not sure that what you are building, if we don't want any issues in the future where somebody will come and litigate or sue. So if we cannot get sorted on the regulatory aspect of things, then we cannot move forward, right? And then also issues with licensing, right? Cross-border licensure. Like, for example, when I came to the UK, one of the struggles I had was that my medical records from Nigeria could not be transferred. So I had to do everything again. I don't know if anybody has experienced that. Dr. Kenneth, did you experience that when you moved? Oh, we can't hear you. You're muted.
You're still muted.
You're
We can't hear
muted.
you.
So I personally, I do create my own medical
Oh,
data.
because
So
you're a
I have
doctor.
everything personally. Yeah.
You're a doctor.
So like,
I'm not.
I created everything and I had them ready for any use. So
Any
it wasn't an
use.
issue for me. But
Mm,
definitely it will be an issue for a lot of people who
a
don't have it. Like
lot. Mhm,
a lot of
100%.
the X-rays I've done, CT scan or
mhm,
ultrasound, I have them in the
mhm,
cloud. So I just
mm.
gave it to them. It was very easy. But for
Oh,
those who don't have this technology, who don't have access to them, of
so,
course, they have to repeat everything from the
everything
start.
again from scratch. So imagine if imagine, and there's some invasive procedures. Thank you, Dr. Ken. There's some invasive procedures that you have gone through before in Nigeria that you're hoping you never go through again. But then when you come here, they want, and then they have to do their own due diligence as well. Because if somebody is taking you on as a patient, they need to know they have to cross their T's and dot their I's. So it's something that is quite a challenge, and it's something that we need to start looking towards, right? The policy and the governance barriers. And then the most interesting one, we are moving to the most interesting one, which is the cultural challenges. This is quite interesting because I've been there and I've seen the issues. So let's move on. Let's move on quickly. All right. Patient and healthcare personnel bias. Like I said earlier, regardless of how much you convince some people, they still just don't, it doesn't just like, why should I be talking to my doctor with my phone when I can go inside Bagada General to see a doctor? Why? Why should I download an app? I've worked with healthcare insurance companies, and they have apps, and they tell you, even, okay, don't worry, we'll book an appointment on your app, and we'll get a doctor to speak to you. They'll say, no, give us an appointment in the hospital. And then as sometimes for the healthcare personnel as well, those that are not well oriented and they don't have the orientation that this is something that will help your work easier, they also be like, oh, why should I talk to my patient online? Like when they can come in. I don't know if this makes sense, but these are some of the issues that like hinder the adoption and the acceptance of telehealth in Africa, because we still believe in that one-on-one face-to-face consultations, which is something that we need to start like eradicating. Okay, let me not say eradicate, let me say alleviating. Like let us make it better, because it will just make life easier for both patients and healthcare personnel. Another cultural, like I said, cultural barriers to virtual care. People are not just, they just don't understand the need why online or WhatsApp, like our parents would say, I should be talking to my doctor on WhatsApp. Like, it doesn't work. And then the traditional healing integration challenges as well, right? And trust concerns, like I said, people are like, oh, if I'm talking to my doctor, do I know who is in the room with him? Like, they're not sure. So we need to also show that these things, if the regulations are in place, like whatever you are sharing is confidential, is private, and to not be used elsewhere, or your data will not be transferred elsewhere. And then digital literacy limitations. A lot of people, especially in the older generation or people that are living in the rural areas, they don't know how to use these devices. So all this is that we are saying that, oh, download an app, is like we are speaking Greek. Like, what are you saying? I should download an app. When, see, let me give you an example. When we had the Cito Health app, we're like, oh, you can chat with us using our AI assistant, Lana. And then this patient told us that, no, why would I be talking to AI? Like, I want to talk to a real person. So imagine us, we're still trying to get her to talk to us like on phone, like do have teleconferencing with us. And then we're not telling her to talk to AI, like we are jumping, like literally. So a lot of people need to be educated, right? And they need to be sure. First and foremost, you need to alleviate their concerns and create trust, and then help them, like especially the older generation. I know we are still young in quotes. We are very like savvy and all of that, but our parents, they are not. So you cannot tell somebody that's 78 years old, like, oh, talk to your doctor online. They will just look at you like you're saying something else. So it's very important to bring this home to them. And it starts by the children from the home telling them that, mommy, daddy, you can actually have a conversation with your doctor instead of you going all the way to the hospital. It saves you time and stress, and you get the same quality of care, right? And then moving forward, solutions. Okay, we've talked about the problems, we've talked about the benefits. What do we do? What do we do? How do we get these things sorted? How do we make sure that there's strong collaboration across the stakeholders, right? So my slides are really showing me stuff today, but it's all right. Trying to move, yeah. So first and foremost, multi-stakeholder collaboration. Oh, oh. All right, multi-stakeholder collaboration. Everybody needs to pitch in. Not just the healthcare providers, the health insurance people, the patients, the healthcare workers. Everybody has to pitch in. Everybody has to collaborate for education, to educate people, to share information, to alleviate their concerns, to be empathetic, and all of this. Put yourself in their shoes. Like, if you are the one, would you talk about your testicular cancer over a call? So we need to be more empathetic, right? And then there should be a simultaneous approach to infrastructure development, policy creation, education and training, and cultural adaptation. It's very important to ensure that these things are in place, because one without the other is going to cause a lot of chaos, right? If you say that, oh, you're creating policies, okay, so if you have the policy in place, where is the infrastructure? Okay, now you have the policy and infrastructure. People don't know about it. People are not sure about it. And then also making it context specific. What is working in South Africa might not work in Nigeria, because in Nigeria we have some certain beliefs. So we should not try to, one of the things that I noticed when we're building was that we're trying to integrate something that worked in the West, like in the Western world in Nigeria. But one thing that we learned was that you have to actually tweak it to fit the particular context in which you're operating in, which is Nigeria, right? And Africa as a whole, we're a very cultural people. So if something is against our culture, we will revolt against it. So we cannot just bring something that seems fine and all right in America, and then we expect it to work in Nigeria. We're joking. So we need to be more context specific, and then create solutions that matches the context in which we operate in. All right, moving on. Please bear with me with my slide today. It's not moving. All right. And then my recommendations right, would be evidence-based policy solutions, development of robust policies and frameworks, things that are actually contextual and relevant, right? Creating policies to ensure that people, even our patients, they are safe. Because in as much as we be like, oh, okay, this thing is regulated and all of that, our patients need to know that their information is safe, and whatever interactions they are having with a professional it is safe, and it is within.
Oh, so sorry. That was a mistake. Miss Adekunbi, can you hear?
Oh my God, I was speaking. I
missed.
didn't know I was muted.
Oh, yeah, that is just went to mute.
Okay, it's okay, it's okay. So it's very important, right? From the research has been done that policy recommendations should include comprehensive telehealth frameworks that go beyond basic regulations to active enablement, right? And then medical education should be incorporated into telehealth competencies, right? Dedicated research funding is needed to develop Africa-specific evidence. So there's a lot of research that has been done in the Western world, but then we need to improve the kind of research. Like, how is it? Okay, the only way we can know what will work for us is if we try it. So, but if there's no funding to even try it, then what we are saying is still far-fetched. I don't know if you get that. So it's very important that funding, right, should there should be more funding allocated towards health and health initiatives, right? And then also removing telecommunication monopolies, because there are some people that for example, especially as regards data and internet access and all of that, they'll tell you that it's only MTN that works in a certain area. Airtel does not work. So if you have MTN, you are gone. Your data will, I'm telling you, like there's a region in Delta States where if you try to make calls, right, to MTN numbers, it won't go. So imagine a whole population there, they've been cut off from telehealth. And then, so if they need help, they have to come all the way, travel far distances. So we need to start working on these telecommunication monopolies that, oh, is this network that works somewhere? It doesn't make any sense. We are in 2025, right? The government has to step in to ensure that these monopolies are lifted. And then also phased implementation. For example, when I mentioned that when we're trying to migrate from physical records to electronic methods, what helped us was that we did not just say that, oh, we are eliminating paper and pen biro. If we had done that, it would have been a disaster. But then it was phased implementation. Okay, for people that are like less severe or chronic conditions, let's move them first. Or for people from 2010 to 2018, let's move them first. I don't know if you get it. So it has to be phased. You cannot just come and overhaul an entire system that people have been used to from day one and then tell them that, oh, you're only going to be able to speak to us online. We are joking. Your hospitals will be flooded. And then public-private partnerships is very important that both the public and the private stakeholders, they come together to ensure that this innovation is well implemented. And then another thing is community engagement from the planning phase. The community in which whatever solution or innovation that serves should be planned together with the community in mind. So there should be representatives. So if you say you are building for people in their 50s, or you're building for people that like cancer or something, you cannot just build outside of them. You have to build with them, being present and sharing their own lived experience so you can build accurately. You cannot build outside of the community that you're building for. It will not be, the context will not even work at all. And then having champions amongst health workers. So I'm sure, Dr. Ken, when you were working, you said you had never like experienced telehealth consultations and all of that. I'm sure there were some of your colleagues that have, but they will not share, or they will not share their experience. So there has to be like dedicated champions amongst healthcare workers to also encourage healthcare workers to also want to use these innovations. Because trust me, there's a lot of bias that why would I be talking to somebody online, or why would I deliver my services online? And then continuous evaluation. No matter what you're building, you have to always evaluate to ensure that what you're building is right and is relevant per time. Moving ahead, I think we've spent a lot of time. So, my slides. No. You guys, I'm so sorry about these slides today. They have a mind of their own. And then, like I said earlier, I said something about contextualizing. You cannot develop a solution for the UK and then expect it to work in Africa. I don't get it. You see what I said? I said developing solutions that address the centricities of African health system. We are quite eccentric in Africa, right? And there are a lot of things that are lost in transit, right? You cannot just bring something that is working in Canada and expect it to work in Nigeria. You're joking, right? And then offline functionality. You mentioned something about mobile health. I don't know if that's the name. I think they are also exploring this. Is it mobile health?
Telemedian
Telemedia.
chat.
Oh yeah, yeah.
It's
Oh
in
yeah,
chat.
yeah. Oh, it's in chat. Offline functionality. Like we know that there's an issue with like online issues. So how do we integrate or build that even offline people can still access medical health? That's maybe via text messaging or whatever. How can we do that so that we do not exclude a certain population from this, right? And then local language integration. This is so key. This is so key. People that can speak, is there everybody that can speak English or understand the big grammars that our medical professionals use? I remember when I was in camp about 10 years ago, and I was told that I had dysmenorrhea or something, and I'm like, I don't understand. At the end of the day, it's period pain. I don't know if you get like, but why did the doctor call it one big name that I did? Well, thankfully, I'm a young person. I could go on Google to check what I had. So we have to make sure that there's local language integration, like at least the layman, people that are not so educated or cannot speak a certain language, are able to converse in the local dialect or the language of the immediate environment. It's very important to contextualize. I said it in the beginning, I'm saying it again. Contextualizing solutions is the way forward, right? Not just building something that if you will work in Canada and expect it to work in Nigeria, that's a joke. And then imagine opportunities, the AI integration potential is absolutely mind-blowing. The things that AI can do, right? I know that people have their reservations, but AI integration has massive benefits, right? It helps things, it's very proactive. It's a proactive measure, AI in healthcare. And currently, you know what is so interesting is that currently for my MBA, I am working on my master's project, and my thesis is on the AI, using the integration of AI in healthcare management, right? And I can't wait to actually have that published. So the AI is absolutely mind-blowing if it is used correctly. Yeah, if it is used correctly. And then cross-border collaboration, like I said, if people are moving from one place to the other, there should be some kind of sync, right, in their medical management. And then expanded service scope, integration with traditional care models, I've said that before, and then hybrid care frameworks. So don't just eliminate face-to-face. Let it be a combination, right, of both. You have access to telehealth and face based on the conditions and the triaging and all of that, right? Don't just eliminate face-to-face, because as humans, we are very communal, and seeing somebody on the other end also helps us, right? Also shows that we are not alone in this. So it's always important to not eliminate the human aspect of all of this, right? We can't really rely only on technology. We also have to, because if we are reliant on technology, then robots will be our doctors, and then all the doctors, they will be eliminated. But do you understand? So, but we cannot eliminate the human side of healthcare, because robots or AI cannot be empathetic. It is the doctors, the humans behind the screens that make impacts, that make the care worthwhile. All right, we'll be wrapping up soon. Priority actions for stakeholders. Develop enabling frameworks, invest in training for healthcare institutions. So as our new doctors are coming out, right, it's very important to have create orientation services to ensure that they're actually very vast in providing care via teleconferencing and the likes. And then providers should also engage in pilot programs that also help to pioneer programs on implementing telehealth and all of that. Educational institutions should update their curricula, because trust me, the educational curriculum needs to be updated. Like things are changing. Like if you're like outside Nigeria, you see something and you're like, oh my God, I would never have seen this if I was not here, right? So we need to have our educational curricula in educational institutions updated to reflect the current state of things worldwide. And then the technology developers, this is for our software engineers. I work a lot with them, so I don't know if anyone is on the call, but yes, Design for local context. I've said that before. Contextualization is key. Don't just develop something that is fine. Is it functional? Does it work? Don't just create something that, oh, wow, the UI UX is, but is it functional? These are the questions I ask like my team, like this thing that you built now is very lovely, but will it work for the people that we for example, you are telling people to scan barcode. It's not everybody that can do that. Our parents can't do that. So if you are building for people like that, you need to make it as easy as possible, as seamless as possible, right? And it's always important that each stakeholder group has critical roles, right? Like I said, policymakers must create enabling frameworks rather than just regulations. The healthcare institutions should invest in training and infrastructure, and individual providers can engage with pilot programs to build evidence. Educational institutions need to update curricula to include telehealth competencies, and technology developers must prioritize solutions designed specifically for the African context. All right, we're wrapping up. Now, what's working? What is not working, right? What is working is that specialized applications is working, mobile integration is working, hybrid models is working. But what is not working? Standalone systems, infrastructure, heavy solutions, imported model, we've talked about it, right? You have, like I said, you have to build for the community you're building for, right? You have to build for the community you're building for. So summarize what's working and what's not. Specialized applications with clear use cases, they show success. For example, the Health Tracker website, very, very sweet to use. No stress. You just book, somebody comes to your house and that's it. And then mobile integration leveraging existing phone penetration works very well as well, like the mHealth in Kenya. Excuse me. Hybrid models that complement rather than replace in-person care are sustainable. Like what I said, you cannot eliminate the face-to-face consultations, but having both pari passu works. And then what is not working? The standalone systems disconnected from the broader healthcare. Why are you building something that they cannot integrate into what is obtainable? It's a failure, right? But if you can build something that can be embedded, that works. And then doing something that requires so much infrastructure and so much plenty things, but it's not functional. So I would want us to know that it is very important that the way forward, right, will require things that are context specific, and then also integration, right, and also strong policy support. So those are the three takeaways I want us to take away from this presentation, is that the way forward, right, requires solutions that are context specific, solutions that can be integrated to what's already existing, and then strong policy support, having policies to guard all of this together. Thank you so much for your attention. Thank you so much for having me today. It's been so amazing speaking on this topic I'm very passionate about. And I welcome everyone's questions and perspectives from your experiences and from implementing telehealth. Thank you so much. And
thank you so much, Ms. Adekunbi Bello. That was very powerful and very insightful. I myself have learned like a lot of things from this session alone. So I want to, yes, you guys can have your virtual claps. I want to also open the floor for questions. If you have questions, you want to share your experience, you want to share ideas, 2 or 3 minutes, just, you can unmute your mic or you can just drop it in the chat box while I can read it out for you if you cannot unmute your mic. Thank you so much, Ms. Adekunbi Bello. That was like very, very informative.
Thank you, Taiwo.
And I really hope that this, what we have learned here today, is not just going to stay with us. It's going to also like help us to start something by ourselves, because not everybody are aware of all these things that has been talked to us today, especially about the policy part. I mean, like no single policy that is also like regulating the virtual care. That's very, very new to me. So I want us to also like share this knowledge with people out there, people that I know that can also make a change in the adoption of telemedicine. All right, so Dr. Kenneth, you can also share.
Thank you so much. Yeah, Adekunbi Bello. Yeah, my 1 hour was a very well spent one. Like you hit at various things that and the one thing that I see someone is on a call. Yeah, one thing that the participants of this particular webinar may not know is that they're actually preparing themselves. You understand? Now, you mentioned the designers, or those who design these solutions. Everyone here, I tell you, is a potential founder, is a potential innovator, and you have told us what we should actually be looking at when we are developing this kind of solutions. That's the way I see it. Right now, I know, assuming, because I was about to ask you this question, should I still build a telemedicine platform in 2025 in Nigeria?
Absolutely. So I absolutely, you should. So like I said, I'm an ex-founder, and one thing I learned doing that when I was building was how not to do it. So I have learned, and I'm still going to build. A lot of times I get that question as well, that are you still going to build? I'm like, absolutely. Every day on my notes, I have new ideas, new things I want to implement. And one thing is, when the time is right, I'll build again and I'll build better. I'll build again and I'll build better. So it's absolutely, I will tell you, yes, yes, yes. That's where the world is transitioning into. I think you should.
Right. Then speaking, thank you so much. It means that I should actually go on, but I should refine my methodologies and my approach based on what you have given today. You've given so much. And the one thing is that no one should actually leave without getting a copy of this presentation.
I will share it. I will share it. I will share it.
For everyone who attended, get back to this document, especially those who are looking at building digital health solutions, not just telemedicine solutions, because there is a lot that connects other digital health solutions with what has been discussed today by Adekunbi Bello. And, is quite, what we as healthcare professionals can do, to actually, better this situation. We know that the government has a lot to do, and you equally mentioned them. And the one that actually speaks to me directly is about, serving as champions, solutions. I looked up, let me share this briefly, just a minute. It's not going to take time, so that those who wanted to do so. You see, there's a Society for Telemedicine and e-health in Nigeria. I don't know who knows about this.
Why are you serious? I never knew.
So this is Facebook. Their last post was 2022.
Well, let me stop sharing my screen so I can see what you're showing. Okay.
Society for Telemedicine and e-health in Nigeria, with 886 followers.
Wow.
Their last post was 2022 after COVID.
That society needs to be revived.
Exactly. You can see, what the issues are. Although the COVID came and it fired everything up, after the COVID, everyone went to your tent, Israel.
Yeah.
So I don't know, this society, we really need to talk to them. Medicine Tech has been trying its best with, of course, without funding.
Well done.
To actually develop a lot of stuff around this issue of telemedicine, and we still have a lot in store. And with proper funding, and we have a lot in store with respect to telemedicine. Taiwo can attest to that. The survey we conducted across Africa is just the beginning of it. We are focusing on healthcare professionals, to upskill them in this area of telemedicine. And if you've been following our LinkedIn profile, you'll be posting a lot of the current. Recently, we conducted a pilot test with an app to see, to actually see how healthcare professionals will adopt it. And, but that pilot somehow failed because of also some problems with the design of the app itself, I must say. Yeah, so there are a lot of things we've learned. I personally have learned today. I won't speak for others, so I will give the room for others to equally speak. I see Taiwo, someone's hand is up. So thank you so much,
Dr. Ken.
Yeah, I will go back and study this document over and over again.
No worries. I will share it once we're done with this. Yeah.
All right. Thank you so much, Dr. Ken. Mr. David, you can also you have it before you can talk. Just unmute your mic.
Yeah, definitely. Good afternoon, everyone.
Good afternoon.
Hi, good afternoon.
Yeah, thank you so much. I really learned a lot from this webinar, and I'm glad to be here. Thank you, Medics in Tech, as well. All right, so I'm a founder and I'm leading a team where we are also building a healthcare product, and telemedicine is also one of, the features we have. So being here, I have like lots of questions, but from your slides, I saw the limitations, which I'm fully aware of. But there were some you pointed at as regards, building in a localized context, also integration to like existing infrastructures in place. While we have some limitations, I believe there are some things we're not pioneering as Africans. So those limitations are, if we compare to other industries, right? Like let me say finance, what's it called now? Finance, the transport industry, where people really build and get funding as quick as possible. I see healthcare as like I don't know why funds are not really allocated to this place. So my first question is how do you think in the long run can we make healthcare more affordable for Africans? Because if you check the NHIS, I'm sorry to cut you, you see that not even I think 5% of people are covered by insurance today, which is like a big issue. And like you mentioned, the older generations, they're not embracing technology. And so, we need to have like a mindset shift as well. So that's my first question.
Okay. So your first question is, how can we make health more accessible, more affordable for...
Yes.
You already have your answer, is making as much as possible, creating a platform or creating a solution that eliminates a lot of logistical aspects of delivering healthcare, which telehealth comes very handy, and then making sure the solution, right, is actually the right fit. So I know this can sound a little bit vague, but I would use my personal experience building, right, for example. So for example, we were building an app and we were building a solution, right? And we built an app, yeah. And we were like, oh, this app has all of this very nice stuff and all of that. But then one thing we learned along the way was that the market for our products, they could not use the app. I don't know if that makes sense. Like the people with the like higher market. So of course the product was for both young and old, but then the people that had like more need for our solution, they could not use the app. They would rather do WhatsApp or even maybe in quote websites. So what we should have done, like this is me giving you like a very honest, vulnerable experience that I had personally building, was that we needed to build by face, like face by face, like not just wanting to have that app that everybody can download and is on Play Store or Apple Store, but like something that actually that people are using. I don't know if that makes sense. So we could have started from the WhatsApp, like see how the adoption is, ensure that we have like returning customers, and like the people we are building for are like they're using it. Like what would have prompted us to like maybe go to a website or an app is that we could not manage our clients again. Like WhatsApp was not enough anymore. I don't know if that makes sense, right? And then we transitioned to, okay, maybe a website, which Health Tracker had, and they were able to scale, and then maybe an app. So one thing is eliminating the logistical aspects of healthcare. And then, like I said, having funding. To be honest, what you said is the utmost truth. In Nigeria, in Africa, healthcare funding is quite limited. Everybody's jumping for the fintech. Which one again? Maybe insurtech, but fintech is our number one enemy. Sorry to say, but that's like I've been in pitch competitions where agrotech. Thank you. I've been at pitches where we are all together, and then somebody coming up with a fintech. Sorry to say, a flimsy fintech idea is getting funding because it's a fast return on investment. But health is not like that. Health it takes a gradual process, right? And it's quite sad, but that's just what the landscape is. And you would come here, like in the UK, you will just be seeing them, you'll be hearing them raising money, like healthcare healthcare innovators, oh, they've raised £1 million. And I'm like, oh my God. But in Nigeria, like we had a grant once. We had a grant, and that was what we used to build our like first platform, right? And that was it. And we were going for many accelerator programs and all of that. At the end of the day, it's one fintech person that will get the money. And at the end of the day, this fintech person will embezzle. I'm sorry, this is, hope I'm not being recorded. I'm just saying. And then the people that are actually building the solutions that would help. See, I think it's just from the government. When the government starts allocating more resources to healthcare, then it will trickle down to us, and then they will see that, oh, they're actually doing something. But it's a jungle out there. So to answer your question, how to make it more accessible is for more increased funding so that it can buffer even we, the innovators, because we cannot say we are building if we don't have money. What are we going to use to build? Do you get? But if we get funding, right, for these things, right, and we are able to build, we are even like, wait, I want to ask you a question, David. Can you build when you've not eaten? Let's even say you're very passionate, right? And you're using because for a long time I was bootstrapping, but it was not sustainable for me anymore. It wasn't. So, and we don't have government funding. The government would rather fund one agrotech business. Of course, they are important. I'm not saying they're not important, but there should be a balance. This is our health we're talking about. People are getting older and they need these innovations. They need it, right? Even our young people, they need it. Do you understand? So it's just calling for more advocacy for funding, right? Ensuring that the government actually sees us and they understand, and they having our people in government to also ensure that policies are made to favor us so we can get more funding. Because trust me, the PR for health tech in Nigeria is not so great. They say health tech, I beg. I'm telling you, I have built, and it was tough. It was tough. We used sweat, blood, money, and at the same time, we were not able to pass a certain stage. So, but like I said, call for more funding, more advocacy, keep talking about what you are doing, and then we just really hope that God helps us, really. So I hope I was able to answer your question.
Yes, you were. Thank you so much. Okay, so I'll wrap up with this. Can you still hear me?
Yeah.
Okay, great. So, I mean, we are aware of the global challenges and opportunities, right? And healthcare is like a big one. So my co-founder who is in the US, right? We did like a comparison, and over there they are really adopting. I mean, obviously we can't compare because they are a developed nation.
Mm-hmm.
So they are adopting telehealth. I think most of their citizens are already covered by insurance and all that. So really we have some barriers that it's not we that are going to do the whole mitigation. It has to come from the top, and like you said,
exactly.
trickle down here to the bottom. So okay, let me just ask this last question as regards AI, because that's also something we are looking to supercharge in our processes. So when it comes to data privacy now, you mentioned EMRs, EHRs, EMRs, and I also believe wearables can also infuse to get user data. So I don't know if you have worked on such. How do you go about collecting and really making sure users' data is as transparent as possible? And do you get my question?
Yeah, I understand. See, Let me be very honest with you. The NDPR, that's the Nigerian Data sorry, the NDPR, whatever. I can't remember the full meaning now. There's the NDPR in Nigeria, and they have their policies and regulations. I think you should maybe either you, since you're in Nigeria, you can go ahead to like read it up, or get a lawyer or somebody that can bring you up to speed on it, right? Because I'm more familiar with the GDPR as well, because I had to do a training on it, right? Because if you work in the UK and healthcare and all of that, you have to be very conversant. But we have the NDPR in Nigeria, and there are a lot of things that you have to actually know when you are building for the Nigerian populace, right? And then if you are building globally, there's a GDPR, and each country has their own. So if you are building in the healthcare space, you have to be very conversant with this, and your solution has to be built around it to ensure that you are not going against whatever policy is in place, so you avoid litigation. See, what you don't want as a founder is that somebody says, oh, their data is leaking. Of course, there will be places, trust me, I don't think there's any system that is foolproof of this, like maybe data leaking and all of that, but that you have like you have a system in place for it to come back. So for example, in my previous organization where we did mental health and all of that, we had our data policies in place, and we always share with the users like how your data is being used, how long it will be stored for, when it will be deleted, what your data is being used for. So you're ensuring that whatever you're using data for is not going beyond what you've told the user that this is what you're going to use your data for. For example, then we used to tell them that we'll store your data for 5 years, right? And then when in 5 years, if you don't come back to use the service and whatever, it will be deleted. This is how it's deleted. And then if there's a breach, this is the protocol in place. Like, it's a lot of work, trust me. But then if you have it in place, then you are foolproof, and then you are able to scale. Because these are also things that investors look out for. Because nobody wants any litigation. In this UK, anything you are doing, even if it's just on a website, they will share you the data policy. I know people don't read it, but maybe you should start reading it to know how your data is being used and transferred and all of that. So if you are building and then you are concerned about data regulations, I think you should actually take time to go and read it up and know what the NDPR says concerning what you're building and how you can navigate it. It's very crucial. And then if you are intending to scale, right, like for a global audience, you also need to be conversant with that. Your NDPR, I personally underwent a training, right, to be able to do this. So I think it's something that is worth looking at. Was I able to answer your question?
Yes, you were. Thank you. Thank you very much.
Right. You're welcome.
I appreciate it. Yeah.
Yeah. Adiolu.
All right. Thank you. Very nice presentation. I appreciate your training that you gave today.
Thank you.
Well done.
Thank you.
I want to say, let me start first with the comment you just made to the other question about the data protection. So the Nigeria Data Protection Act 2023 is in force. So that takes over the regulation which you refer to, NDPR. There's a commission, Nigeria Data Protection Commission, that has been established. And they gave a deadline of June 2024 for data processing and data controller organizations to be registered. I actually just had my hospital registered. Funny enough.
Well done.
I think on Wednesday, we heard that there was going to be a final. We're already late. So we're already in the penalty phase where you pay a penalty for not registering. As a hospital of the government where I work with, we paid we're supposed to pay 100,000 to register.
Oh, okay.
100,000 naira to register as a data processor and controller. Now, there are categories. If you go to their website, I think NDP, Nigeria Data Protection, NDPCN, or something like that, ndpc.gov.ng, ndpc.gov.ng.
Please, everybody take notes.
You can search it out. You find them, Nigeria Data Protection Commission. And you can read their regulations, and then they will let you know. Yeah, thank you. They will let you know what category you belong to. Apply. Now, there are trainings you ought to do. I was able to do a training last year. There were 2 parts to it. I did one part. I got the certificate with data.org, sponsored by the NDPC. I didn't do the second one because I was very busy. So during the registration process, you will fill up all the things you do. You fill up your processes, your certifications, you fill up the areas of data you collect, what you use for, what you have in place for data protection so far, the risk level, all of that. Then at the end, you have to have your data processing officer or data protection officer rather.
Officer, yes. Yes, in the organization.
In your organization. And the person must be certified. Thankfully, I had a certificate, loaded mine. I paid the penalty fee, so everything came to 150,000 naira. And I think the next day I got information in the mail that we have been approved. I'm yet to download our certificate as a hospital. Now, the point is this. Going to the other question or the comments about the Society for Telemedicine and e-Health in Nigeria, which I actually belong to, and I'm an executive member.
Really?
I'm happy the site was brought up. This is the problem we have in our country. And when this conversation was going on, when your presentation was going on, I was telling people around me that I'm tired of going around circles, because in Nigeria, we seem to talk about the same things over and over and over again. When there's no governance framework, people in the private sector space, people in the innovation sector cannot really do a lot. And IT, tech, and health, these are areas that are very sensitive. You don't want to make any mistake, because they're going to be dealt with if you mess up. So it's an area where you have to be very careful. You can't just run around doing anything you like. I'm an IT expert, and I've been in the health sector all my career. So I know how hard it is. But I want to encourage all of you to keep on doing what you're doing. Make sure you're abreast with the laws. Make sure you know what's going on in the regulatory sector. The Federal Ministry of Health and Welfare actively working on what they call the Nigeria National Nigeria Digital Health Initiative, the NDHI, the Digital Health Initiative. That is going on. It's been ongoing for some time. They began with telemedicine, trying to bring up regulations and policies. Then they switched to digital health in general. So it's now called the NDHI. On March 13, our society had a meeting with some of the representatives of the Ministry of Health, Federal Ministry of Health. On April 30th, we have an invitation letter from the minister himself,
the
coordinator of the Ministry of Health and Social Welfare, to have a meeting with him in Abuja. So the society is an advocacy society, it's a stakeholder society. We've been connected with the International Society for Telemedicine and E-Health for many years, for decades, and they've been pushing policy and advocating for adoption, talking to organizations, institutions about putting it in their curriculum and all of that. So it's actually working in the background. You won't see us openly out there as such, but we are very much known to the Federal Ministry of Health, and we've been working with them in a lot of collaborating and giving them counsel, advice, consulting, and all that. We've also tried to work with other federal agencies that have to do with technology that can be leveraged for health sector. So I think instead of in silos, which I think is what I've seen so far, especially people in Lagos, Lagos, Nigeria, a lot of them are working in silos. Everybody's trying to tap into the commercial aspect of things. But if you don't work the regulatory aspect of things, you cannot really move forward. Then my last comment, yes, we can do all that, but how much money is there to be made in the health sector? How much money is there to be made in the health sector? Health finance from the insurance side guarantees you some money. But if you're going to the direct populace themselves, most Nigerians cannot even afford healthcare. So if you're going to leverage technology, you're going to use it as a way of getting pittances so that by scaling up your numbers, you make something. And that's the opportunity to have with digital health that uses maybe mobile apps and other platforms in interlands. So let us all think outside the box. Like you rightly said, develop from your community level what really works. Learn from the foreign organizations and countries, but think about how you can develop something that your people can access, what they can utilize. You know, like where I work, for instance, there's a lot of problem with the internet, there's a lot of problem with power supply, and you can put all the technology in place and it fails you. So humble yourself and come down to the barest minimum and grow from there. Everybody has telemedicine or telehealth or digital health over the last 20 years in Nigeria must have learned a lot about how not to do it. I tell people, I say, I know a lot about how you shouldn't do it. And that's what I bring to a lot of people also. So yeah, it's always exciting when you come up with ideas, but when you test it, you will get to know whether it really works.
Exactly. Thank you so much. Dr. Adiolu, right?
No, I'm an IT guy.
Thank you so much, Adiolu. Like, you just literally tied everything together. You gave more insight on the NDPC. The last time I did my training was in 2021. So that's why I don't have all of that. Yeah. So thank you so much. Thank you so much. It's been so insightful what you've been able to share with us. And then I'm sure David is taking notes. And for every other person building on the call, I'm sure you're taking notes. It's been quite insightful. Thank you. Thank you for that. Thank you.
Yeah, thank you so much, Mr. Adiolu, once again. So before we take in more questions or discussions, let's take a picture just to share the experience of what we have done on our social media platform. So please, if you can turn on your camera, please let's do that. Just a minute. Trying to get this screenshot. All right. So
Lovely, lovely. We have up to 8 persons. Yeah. 1, 2, 3, 4, 5, 6, 7, 8. A lot of others, not yet. Once we have up to half of the attendants turn on their camera, then we can take the picture. Or we just go, okay, yeah. Issa Mustafa, thank you for turning on your camera.
I see your
Mohi
beautiful
Alamo,
faces.
thank you.
yeah.
All right, I think it's enough. Yeah, Taiwo, can you take the picture?
Yes. Okay, I'm just going to do that now. Okay, let's smile. Okay, done.
All right, please share it with me because I always like to have it. Thank you.
Okay. All right. Thank you so much, Miss Adekunbi Bello. It's been a very insightful session, and I'm glad that a lot of us have been able to share ideas and experiences of what we have learned from this session so far. Okay, so Miss Dr. Kenneth, you still want to say something?
Yeah.
I see your hands
so I don't know whether there are others with questions or maybe insights before I say what the next thing I wanted to say. Okay, all right. So thank you, everyone. Yeah, it was very insightful. And this is recorded. It's going to be made available. And of course, the slides are also going to be made available.
Yes, I'm just going to do that now. I'll share it with Olumide if he's on the call.
All right. Then we have a...
All right, I'm on the call. I will get that today.
All right, I'll send to you now.
Okay.
All right. We have Oluma wants to ask a question. But before you ask that question, I want to announce that the month of May, June, and July is going to be the month of digital health entrepreneurship in medicine tech. So, I believe that almost everyone here is involved in one digital health entrepreneurship endeavor or the other. There is no one that will literally spend 1 hour on this kind of call without really having an idea or actually be seriously building something at the moment. And that's why, we are all here. And, Medicine Tech has figured out that many people in that community really needs some digital health entrepreneurship training. And because of that, Medicine Tech will be taking on digital health entrepreneurship from 101 to the highest level from the month of May to the month of through the month of June, July, and then early August. So expect that and get ready for it. And we'll be calling upon you at Adekunbi Bello, of course. You have so much to actually give to the community in terms of digital health entrepreneurship skills. And that is what we want to build in our community, in this next 3 months. So thank you all. But before we go, I think Oluma has a question or a contribution to make. So Oluma, you can go ahead.
Good afternoon. Thank you. Sorry, I'm coming in as we're about to shut down. Okay, so thank you so much for this platform and for the session. It's been quite enlightening. Thank you also, Adekunbi Bello, if I'm not, I hope
just
I
call me
that.
Kumbi. Kumbi is
thank
fine.
You so much. Kumbi, Adekunbi. Okay, Kumbi, please. Sorry about that. So it was really interesting to listen. I'm a physician, so I work here in Nigeria, and something that has been quite intriguing for me is looking at how that a lot of innovations and solutions that are being brought up each time, it's almost like it rides on a wave. And, we had that era of the telehealth, and it was everywhere, telemedicine, telehealth, let's collab, let's build this thing. And then after a while, it kind of like fizzled out. And, at the core of driving any innovation are the healthcare providers and the patients amidst so many other stakeholders. So I have also come to see that there's really, oftentimes, a lot of these innovations are thrown out without much inputs from the healthcare providers themselves in building up. So that's really why I'm also very happy with the Medicine Tech community, because healthcare providers will be the ones implementing these innovations, no matter what, at the end of the day, whether they're AI driven or whatever new innovation that comes up. So I think for me, when I look at it, there needs to be more advocacy for research that captures the perspectives of healthcare providers in any field. This is now one time we're not just looking at maybe like Dr. Kenneth is in radiology. You're going to look at the physicists, the internal physicists. You're going to look at the emergency medicine, unit. You're looking at the various subsets of healthcare provision or healthcare service, and then you're trying to see what are the real nitty-gritty issues that will come up, And so recently, I recall I was in a meeting, and then I had this health tech company come to talk about floating a software that will help capture medical clinical documentation during ward rounds, for clinicians. And while they were talking, and it was so, everyone was high and hyping. It was like beautiful. And I remember, and I asked them, I said, that in every clinical session, there's a team, and the house officer does his rounds, the registrar does his rounds, the senior registrar does his rounds, and then the consultant comes and does their round. So which of these documentations and how are we going to capture each of these documentations if we're going to transition from the, paper to the, use of the software? And it almost looked like I put a spin in his balloon, But what I now realized was, man, you were developing a tool. Didn't you go into the ward and engage with the practitioners and find out what's their workflow like in developing that innovation, So those are those things that I'm just bringing to light, that even for me as a medic, you said something beautiful. You talked about pen and paper, and immediately it triggered something in my mind because pen and paper is, many doctors are getting tired of pen and paper. But when you tell them EHR or EMR, it's even worse, because they have to start typing all the long stories. The patient said my head was moving left and moving right. How are you going to write all of that? And I was with one of my dear friends, and we're innovating, and we said, okay, let's do a research on ambient apps, the ambient scribing AI thing. How will our doctors, perceive it and all of that? Because the truth is, tomorrow someone will come in and say, I'm going to give you a tool. It's going to be recording everything you're going to say between you and your patients. It's safe, the data this. But, what are the issues around implementing it? So I don't want to stretch this out a bit, but it's been a very pleasant conversation, and I'm glad to keep learning about these new things. My key take home is let's keep innovating, learning from our mistakes, and then starting from the bottom up, to make sure that these innovations, whether we like them or not, they have come to stay. Yeah. And we will have to, make sure they work in our context, because we need it. We need it more than ever before. Thank you. Cheers.
Thank you so much, Dr. Uloma. This is so amazing. Thank you for the insightful, the insightful stories, because you're the one in the field. You're the one that knows how these things are, how they are implemented and how they are being used. So thank you so much for sharing that. That's a doctor there. She just said, that people don't want to use pen and paper anymore, but then I use electric the whatever. They don't want to use it. So it's a big situation. It's a big situation. And that's why we need the healthcare champions, right? To encourage your colleagues, and then also, like she said, build for the community you're serving. I mentioned it, and she reiterated on it. It's very important. We cannot just build something that is so far-fetched from where they are going to use it, and then people are wondering what's this? So we need to just make sure that functionality is key, and then contextualize as well. Thank you so much.
Thank you so much, Mrs. Adekunbi Bello.
Soon to be a Mrs. anyway. Soon to be a Mrs. or Miss.
Thank you all. I guess there's no other person that wants to say anything for the next 2 minutes. No. We're taking so much of your time, so we're going to end the session here. And I want to say thank you all once again for joining us today. Special thank you to Ms. Adekunbi Bello for the generous insights and real-world knowledge. It's very obvious that a lot of people are learning new things here today, which is very, very, I think very, very, the right word to use is good, because like we're embracing new knowledge and we are also getting aware about new things that's actually happening that we're not even knowing about. So this would leave us at the end of the session today, but we want you all to follow Medicine Tech if you're not following Medicine Tech for more and more webinars like this. So thank you so much, Mr. Adekunbi Bello. Also, you can follow our LinkedIn. That's true. Let me drop a link to our LinkedIn page, because you know she also shares very insightful and informative things on our LinkedIn.
Yeah, I think Taiwo, you are.
So I'm just going to drop the link here, and you can connect with her, and you know, from that.
Oh, great.
Okay. Just hear me now.
Yeah, better.
Okay.
All right. So yeah, I think you've rounded up everything, and we thank everyone for coming. Don't forget to make a post on LinkedIn concerning this and tag Adekunbi Bello. Tag her. Also tag everyone, tag MIT, so that we can actually push the post. One more thing. The slides as well as this picture we took will be sent to everyone who actually stayed for this call. So you will get it, and then you can use it for your posts.
All right, I've shared the slides, and Olumide just acknowledged, so we'll have access to it.
Yeah, it will be sent through emails. Let it not just be dropped here. Let's send it through emails.
All right. Thank you so much, everyone. It's been so good getting to speak to everyone. Thank you. Have a blessed weekend. Bye.
And you too. Bye.
Thank you so much.
Bye.
Thank you so much.